So thank you very much. So everybody, thank you.
Actually, when this government came in, that was one of the instructions the governor gave to us, that the drugs should be affordable and they should be quality. Patient treatments also. He said he actually gave us stiff instruction that no patient must be turned back because of lack of finance. So we are actually adhering to that. If you come in here, you have money or you don't have money, we must stabilize you. We make you comfortable before you go.
You have money, you don't have money.
If you have money, you don't have money, we're not going to turn you back because you don't have money.
Good afternoon, guys. This time around, we told you Edo is a construction site, yes, but construction site is not the only thing the governor is working on. The roads in the state is not the only thing the governor is working on. The governor is working on a lot of things. Today, I am bringing you to healthcare. I'm bringing you to healthcare, what the governor is doing around healthcare. There's a challenge we are having in the state. Don't forget that the hospital, the central hospital, was demolished by the past administration. When the past administration demolished the central hospital, there was a big problem such that patients, sick people no longer have a place to go to, so they patronize private hospitals. But since Governor Okpebholo came into office, he has been able to do a lot of massive things in the healthcare sector. Namely that the hospital, the central hospital has been fragmented, completely fragmented into 3 places. Here is one of it here. This is one place. Look, this is annex. It's called Central Hospital Annex. Central Hospital Annex. If you go to the sickle cell area, you have one there, and opposite, if you cross to the other side of the road, there's another there. That is, you have 3 different facilities in 3 different locations that we now call Central Hospital. This is because the main Central Hospital was demolished by the past administration, and today we now have what we are doing. Nonetheless, the governor has doubled up to say, look, go and get machines, get facilities, get whatever you can get, and make sure that Edo people get treatment, get health care, good quality health care. So today, I want to show you what we have in Edo State Central Hospital, the free services you have, the doctors, the nurses, the personnel, and we want to talk to patients. Look, I also understand that the space here is not enough, and so they need more space, because look, if you have over 90 bed space at the demolished Central Hospital, today you don't have 20, you don't have 30 bed spaces, you don't have it. You have over 90 seats before, today you don't even have 40. So we want to show you what is on ground, what the governor is doing, the achievement of the governor within this period, and we're going to talk to people. Follow us, let's show you what the governor is doing in the healthcare sector. This antenatal.
And these are the consulting. You have to consulting. We can go and see.
Dispensary, pharmacy department. The stock that way.
This is
The dispensary.
That's the story.
We don't have trouble.
Oh no.
Yes, sir. See the space for
And this year.
Hey, well done, sir.
The space constraint. So they are affordable.
Very, very affordable. Not comparable. Very, very affordable.
And we attend to the poorest of the poor in the society. That's the good thing about the central hospital.
The poorest of the poor.
Yes, any person can access care here.
We don't turn you down because you
Any
don't have
person
money.
can access care here. That's why I've seen a lot of patients outside. If you even go up where the wards are, you'll see it. But the only issue we have here, I think our government will do it. Space. To admit, we even did some admissions today now, they don't have bed space yet. Waiting for people to be discharged so that they can take up the bed spaces. This is the pharmacy.
What is free for them here?
Anti-malaria
Anti-malaria is free.
is free. Treatment for malaria.
It's free.
And testing.
It's free.
Yes, it's free. It's free. And also this hospital too has enrolled into a program, federal government and state government collaboration, CMOC. This comprehensive emergency obstetric care. Any woman that is bleeding, any woman that has placenta previa, any woman that during pregnancy, any woman that has high blood pressure during pregnancy, any woman that has premature rupture of membrane that have done CS before, they come here access care free of charge. CS done free of charge.
And the tests are also cheaper than what you have.
Yeah,
Cheaper.
Yes. As I'm also doing.
So it doesn't mean everything subsidized.
Yes, they do. They do because people that access care here, majority they are Edo State people. So the government is very doing a lot.
The government hospitals.
Clement, he's the head of the department. Yes, and welcome. Yes, we have a license machine. Yes, a license machine.
What does it do?
It helps also for infectious disease control. It helps us for screening of blood. So we have also SPEC.
What is that?
Spectrophotometer. So we can do SB here for neonates, syrup neonates. Also we have our refrigerator for blood, where we keep our blood, safe blood. And we have genotype tank for running electrophoresis machine here. Also. So other machines are also in sickle cell, telemedicine. And we have also in pediatrics. We are operating from three places. We are operating in 3 places. And those 3 places, all machines are there. So
All machines are there?
Yes, we don't carry samples to other labs. All machines are there. So all samples we have here, if we receive patients here, we run all the investigations here. The place is fully up.
Later, yes, sir.
What exactly are you enjoying? What are the benefits?
I'm enjoying so many things. The care, the way they are treating us here, and the environment, everything.
Including the environment.
It's very, very neat and it's okay.
Why don't you go to private hospital?
Because
Is it not better?
No, because it's expensive.
It's expensive.
Yes, so we can't afford it. So that's why we are
Can
here.
you find a private hospital like that?
No, I don't think so because I gave birth to my first daughter in a private hospital, so I know how much I spent, and it was not hygienic. It was not neat.
It was not neat.
Yes.
Look at it, very neat. Lit
Yes,
up. The
yes.
environment, like she said, environment is so cute.
Yes, sir. Even the drugs that they are giving us in antenatal care, everything is so perfect, so okay for us.
Are they
Especially me.
cheaper for you than what you get outside?
So much. They don't even take money from us.
Ah.
Yes, sir. They don't.
Really?
Yes, sir.
That's interesting.
Thank you, sir. Thank you, sir. Thank you, Mr. Okpebholo.
We have quality doctors.
Quality doctors.
Yes.
Doctors. And there are nurses and veterans
They attend to us very well. Yes. Good.
They are very hospitable.
Yes, even the last time I came, last 2 weeks, I okay, they treated me so nice without collecting money.
Of space,
Yes.
accommodation, and all of that.
Yes.
What exactly happened? Where how did it happen that you have space? Before now, you got space. Like something.
Yes. From the old central hospital before it was demolished by the previous government, we had 96 bed space for maternity complex alone. Maternity complex alone. But now we are now having just 20.
So when it was demolished, where did you move to?
When it was demolished, we moved to sickle cell nursing, and in that sickle cell nursing, we had 26 bed space.
From
96 to 26 now 20. But the good thing that about that sickle cell and open nursing services that were not rendering before, because after the demolition, the hospital was just operating as a maternal and child hospital. That's only taking care of pregnant women and children. But now we've been able to include internal medicine, so the adult medicine for the new government we have started. If you go there, you will see that the place has started 2 months ago through the help of our AS, the commissioner and the governor. So people are happy that they have hospital where they can go to. But before now, male people, patients when they come, we don't treat them because just only children and maternal that we are taking care of.
If I should ask you, yes, I don't know who answered this. What is your next plan to accommodate so that you can decongest the plan we have?
Our next plan right now is if you look at the back there's a big space there. My understanding is that the space is owned by the government. So we have a memo ready to present to the governor. They give us the approval for extension.
Wow.
So for extension, once he gives us that approval, then we'll mobilize.
What do you plan to do here?
Well, we are going to at least extend it to create more wards, some theaters, and the lab. If you look at the lab also, it's still not big enough. We are still managing, but if we get that approval, we'll be able to extend it.
How many?
Then we'll be able to extend it. And if you look at also, you have no office spaces for our staff. So we need all those office spaces also.
Most importantly, how many?
If you look around, you see how pregnant women, they're laying on the floor. Like we earlier said, like the earlier said, we have a couple of patients downstairs waiting to get waiting for bed spaces to open before they could be admitted. So if we have that approval to extend that place, then that problem is not going to arise. We'll be able to take care of it.
How many bed spaces do you think you'll be needing more? At least to.
Okay, here, come.
Okay. If we can get what the maternity complex was for 96 beds, so at that time when we were operating 96 beds, everything was okay. If we can get that or even close to it, now we just have 20 beds. If we can add another 40 or 50 to it, it will really go a long way. For theater, we go a long way because there are other incentives that government is bringing now, like this CMO, free malaria treatment. It will attract more patients to us, so we need more space to really operate. The workforce, they are all ready to work. It's just the space that is the problem.
We have the equipment, we have the staff, but just the space is the only constraint. But I know we are just waiting to see the governor. I know when we see him, he will give us the approval, and we're ready to go.
About crowd, how are you able to manage? I assume you have the personnel to take care of the crowd, but for the space, how many statistics can you tell us you manage here? How many people?
We manage every day on a daily basis on ANC. Antenatal clinic, we manage between 100 and 130 every day, every blessed day. Before it was a challenge, but now it's no longer a challenge. Before we're just in antenatal clinic, we're just only 4-5 nurses. Now as I speak, government employed and brought in 6 for us. So only antenatal clinic are 11 nurses, and we have more than enough hands of doctors too to manage them. We are able to take care of them, and this place is a very strategic place because of the accessibility to the place. People pass and they just see Central Hospital Benin, they just come in, please I want to register, and then we give them, you know, the opportunity to do it. It's a very, very overwhelming situation, and we are happy about it. The people are happy, so happy about it.
Guys, I told you malaria treatment is free in those states. Look at it. Support to malaria elimination project.
Yes.
It's free. Testing and drugs is free.
This is the only sickle cell center we have in the state.
What do you do here? Sickle cell center, what do you do?
Yes, they are specialized patients. We call them the sickle cell warriors. They have the sickle cell disease. This is where we manage them. For now, we attend to teenagers and adults here, while the pediatric cases we send to our pediatric ward. So we just see sickle cell patients here. We manage them routinely. Those that come, if their PCVs are low, we transfuse. If they are okay, because there's something we call stable PCV. Most of them know what their stable PCV is. Some will tell you my stable PCV is 19, so we don't worry since you can survive on that PCV. But if there's cause to worry, quickly send to the lab, they check the PCV, we get blood grouping and cross-matching, and we transfuse the patients.
Okay, I see you enjoy free. Do you enjoy free?
Well,
Government do not pay free.
subsidized blood.
Subsidized blood.
Yes, subsidized blood. And most, some NGOs also come and help.
Sometimes you get discharged them too.
Oh yes, yes. Because he's the doctor in charge of the sickle cell center.
I understand you got more staff to help you.
Yeah, we have staff.
More staff.
Yes.
Those the governor employed, you got some here.
Yes.
Yes.
How many were there before in terms of staffing?
Let's go and check the statistics, but we got more.
You got more.
Let me help out with the statistics because I did most of the posting here, so I know. We were, before the employment, I think we were about 4, and we were forced to do, we were running 24 hours. It was a lot on us, but we just managed. But when the governor now employed, we had enough. We sent doctors here. So how many doctors do you have on ground now? I think you have about 5, 6. So you're not.
6 doctors.
Why are you removing?
6 doctors.
Yes, 6
doctors.
for just the sickle cell center.
And other section 2. I've also been
Yes, we also have. So he will tell us about general outpatients, family medicine, and internal medicine.
This is internal medicine. Okay, this is internal medicine. And also Dr. Ege. She's up first. So, where are we now? Yes, we have been able to restart the general outpatient department. We've been able to restart internal medicine, and we've been able to restart surgery department that we did not have after the demolition of the old central hospital. So with this new government, we've been able to restart it. Then the NHIS and the wellness clinic is the person in charge at the back. Yeah, we'll go around, we'll go here.
This was actually started how long? About a month ago?
Fully March. March this year.
Yes. Started 24/7.
Yes.
In the month of March.
What's equipment?
We bought equipment.
Yes.
This government bought equipment.
Yes, government. We have our upstairs. Both female medical ward, male medical ward, female surgical.
Where the other side of them used, where were patients going to?
Internal medicine, we were not taking care of them. We were going outside, going to private hospitals, which I feel was so the economic so much on them.
Yes.
But with this now, we just started it 2 months ago, and the places we are always having a crowd there.
And also, in addition, many were also going to
Primary
health care. That was why some doctors were also seconded to primary health care. Then, when we have been able to bring up this place, all the doctors came back.
The patients are now coming.
Yes.
This place is more affordable.
It's more affordable. It's more affordable.
Okay, this place.
Yes, it's more affordable.
Yeah, somebody should speak on the affordability. Who is talking? Affordability.
Okay.
Yes.
He's our chief.
Compared to places like BBC,
Yes.
where most of the consultants are. This is the only other place where you can see consultants. And so the persons who go there, the prices they cover, most times they are scared of the prices, and they sometimes they have to go to private hospitals or even primary health care. But our prices are quite reasonable, and because we are just starting, and the central hospital has been in place for the different sets of people, different classes of people, and central and different programs and come from different places. And so, and it showed immediately it started. In a very short time, the numbers increased. Even while we were still starting, we discovered that people had the information. They were even coming to come and find out whether they had started. So affordability has been something that is a very good plus to us.
It's a plus.
Yes.
We've gone around the central hospital. Some part of it, not all. But unfortunately, the other end was demolished, and then you don't have a fragmented facility. Thank you for taking us around once more. What is your final word?
Well, first of all, we have to appreciate my able governor, Senator Monday Okpebholo, who took it upon himself, irrespective of the demolished central hospital. People are still sick. We are not going to just lay back because a place is demolished and we not have people who are sick will not have access to healthcare. So he gave us that encouragement and he mobilized us with all the approvals to purchase enough equipment, to hire staff, and to get quality staff to run the services of the central hospital. Even though the departments are highly fragmented, but at the same time, they are still getting the services they require. Then the doctors, we are trying to put up a package also. We have sent a memo. We have discussed with the governor based on the instruction he gave us to see what package we can put together for the doctors. In terms of their salaries, just to discourage them from the Japa syndrome, the governor is looking seriously into that. If you actually look, you see that the Japa syndrome is subsiding, but it has not stopped yet because Nigerians, I wouldn't say Nigerians alone, Africans so much, we love money. So whoever is the highest bidder, that's where we go. But the governor is looking into that package to see that he encourages our doctors with a good salary package so that they would stay back in the country. And if you can also see, our patients are very happy. You've spoken to a couple of them, they're happy because of the services they receive from Central Hospital. We actually have about 36 hospitals, secondary hospitals under hospital management agency. 36, yeah. This is only one you have seen, even though it's fragmented, but it's still under Central Hospital. We have other ones across the 3 senatorial districts. And if you go around, it's exactly the same thing you are going to see there. And everybody is happy, the patients are happy, the communities are happy. And
under this administration, we got information that there were some facilities that were moribund for 29 years or 17 years or 19 years. Tell me something you have done around resuscitating, renovating facilities.
Actually, I will mention a couple of them. Obayanto, for instance, has been down for about almost 22 years. We've had a couple of administrations before now, at least about 3 or 4 different administrations, different governors that didn't pay attention to all those places like Obayanto. It's been closed down for about 22 years or so. But when this governor came in, the governor said, what happened to the people in that community? Is it that they don't get sick? And when they get sick, where do they go? I told the able governor, I said, Your Excellency, please, those communities, they need your intervention. So he gave us the approval to make that place open, and now the place, Obayanto General Hospital, is well staffed. Even though it still need a couple of work done there, but it's well staffed, and they have started receiving services. Then we also have Anegbete. Anegbete has been shut down for about 19 years. Can you imagine how many administrations? 8 years, 8 years, 8 years. How many governors that have gone through before this governor? But when this governor came, the same thing he asked me about Obayanto is what he asked me about Anegbete. Is it that people there don't get sick? I told him, I said, Your Excellency, they get sick, but they just need your help. So he gave us the approval to open the place. And now, Anegbete General Hospital is functioning. Then we have Usugbenu also in Eastern Central. Usugbenu was not completely shut, but for over 5-6 years, it's been moribund. No, it's just skeletal services, but with the governor's intervention, the place is fully staffed now. They have doctors, they have nurses, and they have started seeing patients. And some of those patients that usually go to private hospitals, if you go there now, no more private hospitals. Even their private hospitals are complaining that we're taking their patients. I told them, I said, listen, we are not taking your patients. We're only rendering services that you people cannot render. We make the prices affordable, then quality care, and if you look at the facilities, the patients are happy, the community is happy, and the staff also are happy. Then look at Unemosu also. Unemosu is not completely shut down, but is being crippling. No staff, no doctors, no nurses, and only Audley. Audley alone cannot run a hospital. But when this governor came, he gave us the approval to hire clinical and non-clinical staff. Unemosu now, they have a doctor, they have nurses, and they've started hiring. And that is also generating a lot of revenue for the government. It's also enhancing the patient care for the community. So I would say a very big thank you to my able governor, who with his shine agenda, Edo is shining.
Thank you so very much. I wanted to ask from you, are there other facilities that are still moribund that you think you still want to work on in your next phase of work?
Well, my next phase of work, I have a couple of memos put together. Some of these facilities, even though they are functioning, they still need some renovation. So that is exactly what we're working on. We have some memos put together for our able governor for approval. Once he approves them, then whatever needs to be done to revamp many of those hospitals, we'll put it in place and we'll get them running efficiently.
Thank you so very much. The ES, Honorable ES, Edo State Hospital Management
Agency.
It's not a body anymore, agency.
Yes.
Thank you so very much.
You're welcome.